Hi, I'm Stephanie Melton. Welcome. In today's webinar, I'd like to share with you some tips of planning a successful diabetes prevention program. Starting a program from scratch can feel overwhelming. There's a lot to consider and a lot of decisions to be made. Today, I want to share with you some ideas about effective and efficient program management, and in particular, about what to plan for when you're on the ground offering your program week to week and month to month. This information is designed to be a supplement for materials provided by the National Diabetes Prevention Program and was gathered from stakeholders all across Florida that are offering diabetes prevention programs in communities. First of all, the most important thing is to think about your messaging, and this sets the stage for your marketing. It's important to know your message. So fortunately, with the Diabetes Prevention Program, there's a lot of valuable information that validates using this approach to prevent disease. The key point is that diabetes can actually be prevented. And with small lifestyle changes, your community members can do this too. When thinking about different target audiences, it's important to frame this message in specific ways. For healthcare providers, framing the diabetes prevention program as an important tool to validate and improve the work that they're already doing is important. So oftentimes healthcare providers are making the recommendations to patients to change their diet and to get more physical activity. But if we can convince healthcare providers that this is a supplemental resource for their own patients, that we can help their patients do better, this is a win-win for both the providers, the patients, and your program. Another audience to consider, of course, are the health plans and decision makers in the business world. We need to remember to speak their language, which is numbers and cents. So if we can remember to promote the cost benefit and the increased productivity that comes from healthier employees, they're more likely to listen to us. And finally, our patients, our participants in the program. Remember that preventing diabetes may not actually be their first motivation in joining this program. They may have more immediate concerns, like just feeling better or losing weight or having more energy. The important thing is to tap into their intrinsic motivations. What really drives them to do better in their lives? Maybe it's to have more time to spend with children or grandchildren, or to have the energy to continue favorite hobbies and activities. It's important that we understand who we're targeting in our messaging and slightly tweak the message to fit their needs. The next step is developing a marketing plan. Let's face it, marketing can be costly, and it depends upon the staffing, the resources, and the skill sets you have available within your organization. These are important considerations to make from the beginning. Another very important consideration that sometimes we forget about is determining who our target audience is and how they gather information. If you're trying to reach seniors and you're concerned about whether or not they'll use online media sources, then take a different route. Use weekly newspapers and flyers in locations that they tend to frequent. Be creative in how you approach groups and individuals. For example, if your worksite program is getting off the ground, then pull in the wellness coordinator for that company to share announcements and emails with potential staff that could be a part of the program. Beyond spending money on marketing, remember that there are low-cost and no-cost opportunities to market our programs in our communities. One is the 211 Information and Referral Service. This is a free service that's available county by county and is an excellent source of information and referrals for the general public. Another tip that we would share is to make friends with a local newspaper reporter. They are always looking for stories. Creating a feature article on your program is a great way of getting free advertisement. Another option is using the online community listings of community events from the local newspapers. Beyond using traditional print media and online media, I would suggest that you get out there. And what I mean by that is conduct your own outreach program for your own program. Beyond traditional print or online media, I suggest that you get out there. The more you can make your program known among stakeholders and community members, the better. So there are ways of getting your name and your program known to the public. Participate in community events like health fairs, or provide presentations on diabetes preventions for lunch and learn programs or hospital grand rounds. The more that you can get out there, the better. Remember that. And also be strategic in your messaging when you're speaking with people. One great tip is to devise an elevator speech. Now, what an elevator speech is, it's a succinct way of describing the who, what, when, where, why, and so what of your program. Decision makers will appreciate a succinct and professional delivery of the key points about why your program is valuable and what it can do for your community. The end goal of a marketing strategy is to get to people and to get people in the door. This can be harder than it seems sometimes. It can be challenging to not only reach the people that have prediabetes, who are at risk for diabetes, and are ready to make lifestyle changes. Those are the two key factors in recruiting participants. Now here I'll offer a couple of suggestions. One is to tap into the natural resources we have in our communities. And I'm thinking of champions and natural connectors. Champions are individuals that are excited about health promotion, are well known and well liked within their community. And connectors are those folks that just have that talent for connecting and pulling people in. They tend to have wide social networks and tend to know a lot of people too. The great thing about champions and connectors is they use our best form of advertising, which is word of mouth. This is the most powerful advertising we can get, and it's free. The next tip is to approach potential participants and ask them about their readiness to change. We provided an easy-to-use readiness to change screening tool on the fldiabetesprevention.com website. This is a quick and easy tool to administer to folks to get an idea of where they are in their lifestyle change process. Maybe they've never thought about prediabetes, or maybe they've been trying to make lifestyle changes of eating healthier and getting more physical activity, but they're just not there yet. This is a great tool for identifying who is ready to start a program now, and maybe who you can come back to in a few months and see if they're ready then. Another great idea for building excitement about the diabetes prevention program is to host an event we call a Session Zero. This is an open community event where you provide education about diabetes and prediabetes and explain how the diabetes prevention program works. We often will pull in local celebrities to increase the status and appeal of the event. This is a great way to connect with people who are thinking about diabetes and wanting to make changes in their life. The tip of using the Session Zero is a great starting point for thinking through the nuances of delivering your program. And I'm going to tell you that the planning doesn't end here, it continues. As you're deciding when and where and how to offer your program, think about where your potential participants or your target audience, where they are in their lives. The ideal scenario is to make attending your classes as convenient as possible. Think about the location, think about time of day, and even days of the week to make it as convenient as you possibly can. The goal is to decrease those barriers from the onset. Another tip is to consider how you communicate with your participants outside of the classroom. So collect contact information from the beginning and ask them how they want to be contacted. Perhaps phone calls or emails or text messages is the best way, but let them tell you how. This is important. Keeping motivation going through a long-term program really depends on building rapport and maintaining that level of support as they're working through the journey of lifestyle change. Another consideration that sometimes we forget about is literacy levels. We recommend that you use visual-based teaching tools as often as possible. We know that visual images are more meaningful and memorable to all of us, but especially when concerned about literacy levels. Another tip is to be creative in how you present the curriculum. Know where your people are coming from. Know about the concerns and the issues that they're facing every day. For example, if you're working with a group of busy working professionals, give them time-saving tips on how to prepare healthy foods. If you have a group of people that is worried about their food budget, providing cost-saving tips about eating healthy can make or break their experience in the program. Another tip for maintaining motivation is to focus on retention. It is a long program, we understand that, but those weekly emails or calls from their lifestyle coach can help keep people engaged. So if attendance starts to slip, reach out to them. Another important consideration is how you'll deal with makeup classes. Make sure that your makeup classes are convenient. You could use online platforms that are free and available to all, like Skype or GoToMeeting or Google Hangouts. Being creative in this way can help keep people engaged and help people from falling off the bandwagon. As you move through the curriculum and you get to the maintenance phase of the program, that's an excellent time to bring in supports. Bring in topic experts from other organizations that have skill sets and information that maybe you don't. Prompt them about how your group works, but bring them in to increase the variety and the interest in your class, especially as things wind down towards the end of the program. Another question that we actually receive quite a bit is whether or not to include loved members or friends within programs. Now, this decision is up to you and what works best for your program, but there are a couple of options that could be very effective. One is to invite loved ones, family members, neighbors, friends, whoever that support person is for your participant, to attend the entire program. You would simply audit their information if they don't have prediabetes and not include it in your outcome evaluation. Another tactic is to use designated bring a friend classes, where there's predetermined dates where everyone is invited to bring someone. And we found that including loved ones in the DPP program can really make a difference in helping work through the lifestyle change and helping change the health habits within the family and community. The final question that we receive a lot is concerning incentives and prizes. Now, incentives and prizes can be really fun and can be excellent tools for validating success, and we love validating success. You can do these in a number of different ways. You can randomly draw names for prizes, or you can attach incentives to meeting milestones. That's up to you, and of course it would depend upon your budget or any donations that you can receive. But if working with those kind of things is not in your budget, don't worry. The program can be just as effective without them. Too often in program development, we give lip service to evaluation. Make evaluation part of your process. Whether you use quick paper surveys or one-on-one conversations to judge participant satisfaction, this step is critical. If you count your progress and your success with your participants, you are building the case for continuing to offer your program. This is important as you go through year after year of wanting organizational support for your program. So you really need to seriously consider how you evaluate and plan for evaluation from the beginning. So you have baseline and post-program results. Another important thing that we sometimes forget in group facilitation is celebrating successes. The small successes and of course the big ones too. This can be done on an individual level of just cheering on small accomplishments that participants make each week, or it can be done on a group level of telling weight loss at certain points throughout the year and sharing it with the group. It is important to validate the hard work and the effort that our participants are putting into this program. Not only does it enhance the motivation for them, but as lifestyle coaches, it's important to see on paper and in front of you that your efforts are worthwhile and are making change in people's life. The final tip that I'd like to leave you with is actually a list of strategies for success that we've developed and placed at the website www.fldiabetesprevention.com. These tips are organized by session so that you can match them to your curriculum planning as you go through the course. We hope that today's webinar has been useful to you, and thank you for listening.